Good afternoon, everyone. So if you would like to get your seat, whoever getting food, enjoy the food, or we will start. We are a few minutes late, so we want to make sure to accommodate everybody who have registered, but it is my pleasure to welcome you all. And my name is Iman Hakim, the Dean of the Mellon Unit Zuckerman College of Public Health here at the University of Arizona. And it is truly a pleasure to welcome you all to this special gathering. This is our 2024 homecoming celebration. So before we start, I would like to do the land acknowledgement. Before we begin, we respectfully acknowledge that the University of Arizona is home of 22 federally recognized tribes. Today, with Tucson being home to the O'odham and the Yaqui, committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nation and indigenous communities through education offering, partnerships, and community services. So today, we honor the incredible accomplishment of our alumni. We also celebrate our Mellon Unit Zuckerman College of Public Health, or we like to call it MEZCOPH, community. And we recognize that transformative public health work that grows from the education and experiences shared within our college. So homecoming is a time to reconnect, reflect, and celebrate our collective achievements. What a better way to do so than by honoring 3 exceptional individuals who have made significant contributions to the field of public health. Today's we recognize their passion, dedication, and impact on both a local and global scale. Our homecoming celebration is always a special time for us here at MEZCOPH. It's more than just a tradition. It's an opportunity to affirm the bonds we share, appreciate the progress we have made, and look toward the future we are determined to create. It's a time to reconnect with old friends, to reflect on our shared journey, and to welcome back those who have carried the spirit of this college with them. We are excited about the potential our Alumni Council holds to unite our vibrant community and drive meaningful impact for the future of public health. Finally, I want to thank Amber Richmond, our Manager of Alumni Engagement and Student Strategic Initiative, for her work with alumni and for organizing our homecoming celebration today. Amber, where are you? So she's back in the back. And I would like to just add something you might not know about Amber. So Amber has been instrumental in creating the relation with the alumni, being the data-driven. In addition to being her work she did with our accreditation, she has been selected to present her work into the 50th anniversary of the Council on Education on Public Health that is in 2 weeks. So she will be representing to all the accredited body what MEZCOPH has done in using LinkedIn and all to engage all of our alumni and to be example for the other colleges. So thank you, Amber, for representing us. So after this, that is what you are waiting for. So it is now the time to recognize our award winner. So we start first with the Global Achievement Award. So the Global Achievement Award recognizes alumni who have brought honor and credit to the college, the University of Arizona, and their profession in the global arena through professional achievement or humanitarian service. So we are thrilled to present the Global Achievement Award this year to Dr. Bojosi Hashmantel, right? Right. I was practicing the name. So Dr. Hashmantel's work has transcended border, making a remarkable impact on global health initiative. She has made significant contribution to environmental and occupational health, focusing on disease prevention and control. With a PhD in occupation and environmental hygiene from the University of British Columbia, she has worked across Botswana and Canada, leading communicable disease exposure prevention initiative and developing occupational health standards. Her global impact, particularly in tuberculosis infection control, reflects her commitment to advancing public health at the international level. Dr. Khamontel, please join me on the stage to accept your award. Give you a hug. Here is your award. So we'll take a picture and then you can go. No, just say a few words.
Okay. Thank you, Dean Hakim, for this. Thank you, Amber Richmond. I say Amber is a detective. Wherever you are, she'll find you. I'd like to start by thanking the leadership, faculty, and staff of the MEZCOPH for this award. I'd like to acknowledge the presence of my Tucson family, they're right there, my friends and mentors. I'd also like to especially acknowledge one of my mentors, Professor Paloma Bima. I don't think she's here today. But when I completed my MPH at MEZCOPH in 2008 and expressed my interest in pursuing a PhD, Dr. Bima said, you know, there's a very good environmental health school in Canada, the University of British Columbia. I said, who wants to go to Canada? But I stand here today, 16 years later, as a polite, forever apologizing, Tim Hortons slurping Canadian with access to free universal health care. Students, listen to your mentors, they know these things. This award was unexpected, but it came as a welcome and inspiring surprise. In Botswana, where I originally come from, there's a phrase commonly used among women. The phrase is mostly used when women celebrate, encourage, and call one another to action. The phrase, bereka mosadi, which translates to woman, get to work. This award says to me, bereka mosadi. I've had the opportunity to stalk the MEZCOPH website and I've seen some of the initiatives that have happened at MEZCOPH in the past 16 years. The Global Health Initiative, ASRAC, Applied Health Policy Institute, to name a few. I'd like to say kudos to Dr. Iman Hakim and the leadership of MEZCOPH on this. This could not have been created at a more opportune time. We as public health professionals have always known the importance of public health in the grand scheme of healthcare. Unfortunately, it hasn't always been that obvious to global political leadership. Back in 2011, I conducted data collection for my PhD research back in Botswana. I interviewed, among others, health policymakers, public health specialists, and healthcare workers. One of the public health specialists used an analogy to express how those who had the power to make decisions about what gets funded and implemented viewed public health. He said public health is something, they view public health as something that is done after the kids go to bed. When you have extra time, that's when you do public health. Which is unfortunate because we know the importance of it. Now, the good that has come out of the horrible COVID-19 pandemic that claimed so many lives is that it has left all of us with no doubt that that decisive public health leadership and action are needed, and urgently so, and they are needed home and abroad. The disease outbreaks, such as monkeypox, that continue to emerge in places like Central Africa, the many parts of the global south where people still do not have access to clean and safe drinking water. Vaccines not reaching the people who need them the most. These are our call to action. These are our call to continued and amplified action as public health professionals. I have no doubt that MEZCOPH and the many impactful initiatives and far-reaching outreach programs will continue to equip students as they did me, with much-needed public health skills, that they will continue to improve the health of communities across our entire global village. Thank you.
So next, we will present the Young Professional Achievement Award. And the Young Professional Achievement Award recognizes alumni age 40 and under who have attained prominence in their field. Today, we present the Young Professional Achievement Award to Dr. Tanya Payapli. Tanya? Tanya has already made a profound impact on public health early in her career, and she shows great promise as a leader in health promotion. As the CEO of Breeze California, Dr. Payapli leads efforts to improve lung health across 8 counties in the San Francisco Bay Area. A physician turned to be public health advocate, her personal experiences with illness inspired her shift from clinical care to system-wide health policy leadership. Through her work, she advances initiatives in tobacco control, air quality, and disease prevention with a focus on vulnerable population. Dr. Payapli, please join me to accept your award.
Thank you, Dr. Iman Hakim. And thank you for spying on me, Amber. So after a few years after graduating, Amber connected with me earlier this year and tried to see what I was doing on LinkedIn. And then we just chatted about getting for an alumnus program. And I was super excited, but little did I know that I was coming back to Tucson today. So thanks, Amber, and thank you, Dr. Iman Hakim, for this achievement award. And this was really unexpected. I did not know I was getting an award for being under 40. So and I still remember the date I got the university admission notice that I got admission into the MEZCOPH program for Health Service Administration. So I was very excited and thrilled. Little did I know that what I was getting into. And but all those times were very well nurtured by our faculty and staff here. They kind of helped me into deciding what programs I should go in, and I was able to talk to our faculty. Dr. Willis Spencer was able to meet with me, and we had a coach who could kind of talk about things because I really had my hands and legs full. Being a physician, it was a little confusing for me as to, do I go to public health? But I certainly made the right choice because it was very rewarding after I joined Breathe California as a volunteer. So I'd like to thank Dr. Hakim for this opportunity and for the award. And also my mentor, Margot Seidner, who might be watching this in San Jose. Margot, thank you. She's our CEO for 40 years, and she decided to give the baby to me. Our organization is 113 years old, and we take internships and public health mentoring so seriously because it's our legacy. And public health, like I say, is a necessity. It's not just a critical part of healthcare field. I am very grateful for this village and this award. And of course, my parents who pushed me to beyond my limits. So to my mom and dad, and of course, my husband and kid, who's putting up with me through these busy times. So thank you. Thank you for this award.
So finally, we will present the Professional Achievement Award. And the Professional Achievement Award is given to a person who has attained prominence on his or her field. We proudly present the Professional Achievement Award to Kim Bourne. She's somewhere here. So Kim Bourne, whose outstanding contribution have set a standard for leadership and vision in public health. Kim Bourne is a leader in talent recruitment and community relations at Bourne Companies, a Tucson-based commercial real estate firm. She has held the role of trusted advisor for the Zuckerman family's philanthropic undertakings in many capacities over the last 3 decades. With a background in public health and fundraising, she played a pivotal role in raising over $16 million for the Melanie Zuckerman College of Public Health and led community-focused health initiative in Tucson. Kim's passion for public health, combined with her contributions to education, health, and philanthropy, has earned her numerous local and national awards. What Kim doesn't know is the second award. On a personal note, I want to thank Kim for her unwavering support and dedication to our college. For this, I will give you a hug. She has always returned to give her expertise and guidance in development during pivotal moments when we needed her the most. Therefore, in addition to her Professional Achievement Award, I am pleased and delighted to offer her a token of thank you and gratitude from all of us here at MEZCOPH for your dedication, continuing support, and friendship. So Kim, please join me to receive your 2 awards.
2 awards.
So we start with the Professional Achievement Award. I'll do that. Put that one.
I'm not that talented.
And we'll give you to them at the end. And the MEZCOPH College Award.
Oh.
Now your microphone.
I told Aman she better not make me cry, because I'm an ugly crier, as my children and friends and husband know. So as I was thinking what to write, I had a great brainstorm last night, which I deleted by accident this morning with one quick swift across the phone. I started to freak out, and my daughter Lyndon said, "Mom, who cares? Just speak from the heart. It's no big deal." So I'm going to speak from the heart. After 25 years of involvement with the Zuckerman College of Public Health, I never saw myself being up here in front of all of you accepting an award. I always thought my reward was all the people I met during my career, which many of you sit here this evening, and I'm so grateful to have you here. The community impact that we made together, the millions in scholarships we provided over the years, Dawn and Night, the 20 pounds I gained in those 25 years, and the database entries, Brian Rowland, that I screwed up time and time again. But in all seriousness, I'm honored to have this award and to be with you tonight. Our Zuckerman College of Public Health, as Iman and others have already shared, is about health promotion, disease prevention, protecting our health, and eradicating health disparities. It takes significant collaboration and innovation to make all of this work. MEZCOPH had an announcement, which Iman restated tonight, about the launch of the Ending Pandemics Academy, which made me think about the late Dr. Kent Campbell. He once told me that public health professionals do their job if it goes unnoticed. And they're really like sport referees, which was perplexing to me. What do public health professionals and sport referees have in common? My husband's gonna love all this. So you see, for those who love sports and don't quite understand public health, I'm going to unpack it for you here tonight. You see, public health professionals are just like sport referees in several ways. First, they both enforce rules for fair play. Just like referees enforce rules to maintain fairness and safety in sports, public health professionals establish guidelines and regulations to ensure community well-being and prevention of harm. 2, monitoring and prevention. Referees and public health professionals are both vigilant, monitoring for potential fouls or unsafe behaviors. Similarly, public health professionals track disease outbreaks, monitor trends, and take preventative measures to avoid crises before they escalate. Number 3, sport referees and public health professionals make tough and unpopular calls. Referees often have to make decisions that some players or fans disagree with, even if necessary for the game's integrity. Public health officials may face resistance when recommending quarantines or mask mandates, but they act in all of our best interest. 4, promoting safety and fairness for all. Public health professionals and sport referees do this similarly. Referees keep the game flowing smoothly, and public health professionals enable the career so that there's a safe environment for everyone. They promote equity by ensuring that health services and interventions reach all individuals regardless of socioeconomic status. And finally, they both facilitate the game or community health. Referees keep the game flowing smoothly, and public health professionals enable the healthcare system to function effectively by coordinating efforts, reducing disease burdens, and promoting healthy behaviors. Does public health make sense to you now, Dawn? I'd like to say that our alum and new colleague, Mark Smolinski, would agree with us that his global team has acted as our fearless air marshals to protect all of us. We are forever grateful for the launch of Ending Pandemics Academy here at the University of Arizona, and for Mark and his team. Congratulations, Dean Hakim, and all of the College of Public Health. Bear with me as I walk down memory lane for just a moment. It was in 1999 that I started on this public health journey through my work with the Komen Breast Cancer Foundation, collecting data and developing a gap analysis that I did not realize would traverse 25 years. I'm here today because of meeting Dr. Jim Dolan, Kent Campbell, Roy Drockman, and Mel Zuckerman. They invited me as an advisor and board member with the Arizona Prevention Center, and I'm so grateful for the journey they took me on and all of their encouragement. In the year 2000, they convinced me to be the first director of development, where we launched a major capital campaign to build what we know as Drockman Hall. Before Drachman Hall, we were located in over 21 different buildings across Tucson, but now we're all together. Working with Roy Drachman was such a treat. I'll never forget his first bit of advice for me about fundraising. He said, "Kim, you just don't let anyone say no. Do you hear me? You don't let anyone say no. In fundraising, no means not yet. Ask my husband." With Mel, he became Uncle Mel, really, to me, and he always pushed me out of my comfort zone. For example, he took me aside after a meeting and asked if I realized that I laugh when I get nervous. I said, "No, I didn't realize that." And he said, "We got to fix that before you start asking people for big bucks." The following week, I was enrolled in a leadership course at Canyon Ranch, and after several sessions, I no longer laugh when I get nervous. Mel helped the college outside of his own philanthropy. He said, "I want you to meet a friend of mine. He owns Home Depot, so don't scare him away. His name is Arthur Blank." This resulted in me walking out of that meeting room with a principal gift that set the College of Public Health and my trajectory on a completely different level. So who knows where we would be today if it weren't for Mel, taking me aside and helping me with that nervous laughter. I recall a significant meeting in New York City with two major prospective donors, Donna's going to remember this, who owned a professional sports team. And I was talking like I knew what I was talking about. I got the sports a little mixed up in conversation. I thought they owned a basketball team and they really owned a baseball team. And the dean at the time, Marie Swanson, said to me, "Kim, don't worry about it. Well-behaved women seldom make history." Ever since this meeting, I've been known not for my sports knowledge, but for my fearlessness. Speaking of fearlessness, I'm honored to work with such an outstanding group of people throughout my 25 years, and our incredible board, and our fantastic and fearless leader, Dean Hakim, who likes to have lots of fun and always makes a significant impact. Fundraising is a team sport, and the University Foundation and the College of Public Health have teams of people who work tirelessly, say that 3 times really fast, and collaborate to get things done. No one is ever doing this job alone, and I thank everyone for contributing to my 25 years, the painful ones and the growth ones, and for the success of the College of Public Health and my career where it is today. Cheers to our future together and a healthier world. Thank you so much for this honor.
I'll carry both of your gifts. Come join me. Yeah, we'll get you back. So thank you, Kim. And as Kim mentioned, the college is proud to always still follow the legacy of Mel, who was like an uncle, but he was also like a dad for me as well. Taught me a lot, and the college, we assure it's always following the legacy of Mel and Edith, and always carrying their name. So each of these awardees embody the spirit of public health and our college values: integrity, innovation, and a deep commitment to improving the lives of others. We are incredibly proud of them, and it is our great honor to collectively recognize all what they have accomplished today. As we celebrate the achievement of our awardees, it is also a moment to recognize the bright future of public health. The work of our award winner demonstrates that together we can overcome challenges and improve the health and well-being of communities worldwide. So thank you to everyone here for your ongoing support and commitment. Let's carry forward the optimism and inspiration of today into our future endeavor. So thank you for joining us in this celebration and for your ongoing support to the college, our mission, and our alumni. So please continue as we join together. Congratulations, our awardee. There is a photo booth over there. Have fun, get picture, and continue. The food is still around, and get good at networking. And thank you all, and bear down. Go for the photos. So have fun photos and have fun with groups and families.